Okay. Mr. Brown, I think you have a problem with your heart.
Okay.
The problem is called angina pectoris.
What does that mean? You can explain that.
It's a Latin term. It's the pain that you get in your heart when it doesn't get enough blood or oxygen supply. Okay. It's a little like the pain you get if you drink a glass of ice water way too fast and you get that severe pain in the back of your throat.
Yeah.
Or the pain that you'd get if you make snowballs in the winter without gloves on. Or maybe the pain your wife may know about when you wash potatoes or radishes under the cold water faucet too long and your hands get very painful. Okay, those are all the same kind of pain when an area of your body doesn't get enough oxygen or blood supply. It's caused by blockages in the heart arteries, most likely related to cholesterol.
Ooh.
Okay. There are lots of medications for this. There are ways to make you feel better. We have to sort what the best treatment is for you. Okay. First of all, I'd like to prescribe some medicines for you. It's very important that you take an aspirin every day. I'd like you to take a regular aspirin, or even better, a coated aspirin, because a coated aspirin is easier on your stomach. That acts as a blood thinner. Okay. People who have angina could have a heart attack if they have a blood clot in the area of the problem artery. Okay. And the aspirin will help thin your blood to keep that from happening. Okay.
So I'm just wondering if I take the aspirin, continue that for life? That's something that I'll just need to always take?
Most likely. Lots of doctors recommend aspirin for everyone over 45 years old to prevent heart attacks and strokes.
Okay. The baby aspirin or the regular aspirin what should he be taking?
A baby aspirin is good for nearly everyone, but for bigger people, sometimes it's not enough. So I would recommend either 2 baby aspirins, which is a half an aspirin, or 1 aspirin a day. Those are both excellent treatments.
The 81 milligrams, is that the strength?
81 milligrams is a quarter of a regular aspirin. A regular aspirin is 325 milligrams. So anything over 160 milligrams is fine. 2 baby aspirin or a regular aspirin. Okay. I'd also like to prescribe a medicine for you called nitroglycerin.
Okay.
That's a medicine.
Don't know about that one. All these big words. I'm sure he'll write it down for you, and we'll figure out what you have to do to take it. All right.
I'll write it on a business card.
Thank you.
Nitroglycerin is a tiny pill that you put under your tongue if you have the discomfort in your chest and it doesn't go away after 5 minutes. Okay? You put one under your tongue, you can wait 5 minutes, and take another one if you're still having pain. You can take up to 3 nitroglycerin, but if you have pain after 3 nitroglycerin, you need to dial 911.
It just dissolves in the tongue when you put it in
Right.
there. So then, do I take that every day, or only if I...
Only if you have pain that doesn't go away. Okay. There are some side effects of nitroglycerin. You may get a headache. You may feel lightheaded. If that's the case, sit down or lie down. And you may feel some burning under your tongue when you take the medicine. Okay? I don't expect you to need to dial 911, but I tell everyone that I'm teaching about nitroglycerin about that, because if you know the rules of nitroglycerin, you will do well. I'd like to start you I'd like to start you on another medicine that helps the chest pain, that helps you keep from getting the chest pain.
Okay.
It's called atenolol.
Can you spell that for us?
Okay. I'll write it on the card.
All these meds. Okay.
It's a medicine that lowers your heart rate, lowers your blood pressure,
So then it lowers the heart rate, helps it work slower.
lowers the blood pressure, makes the heart use less oxygen, and helps prevent the chest pain.
So I'm wondering, you know, if I get better, can I cut down on some of these meds, or is this something I'm taking for life?
First, we have to find out what the problem is with your heart. Okay? And I'd like to schedule you for a stress test. This will be a special stress test where you walk on a treadmill and we take pictures of your heart by injecting a radioactive substance in your veins both at rest and during exercise.
Okay.
The radioactive substance is taken up in your heart muscle and we have pictures of your heart, of the circulation of your heart.
Okay.
That way we can tell what the best treatment would be for you.
Okay.
Some people do just fine on medicines. Have you had friends or family who have had an angiogram or angioplasty?
No. No one that we know of.
An angiogram is a test where we look at the heart arteries by taking pictures of a clear liquid that shows up on X-ray as it goes through the heart arteries.
So how does that work? Do you do with an injection again?
This is
Do you put a tube in there? How do you see the arteries?
okay. This happens in the hospital.
Okay.
If there's a large area of your heart that is involved, then we would send you to the hospital where, after putting numbing medicine in your groin area, they would give you medicine to relax, and they would run small plastic tubes up the aorta into the heart arteries. It doesn't hurt. Once that intravenous line is in, you don't feel anything.
Ooh, I don't know.
Most people find it pretty interesting, actually.
So, and then you can see it? So he could see as it's happening?
Right.
Oh, well, that's cool. Can I watch too? I don't know if they let you. Ask him if he'd let me in to see it. I'd love to see it.
You get to watch, you don't.
Why not? I want to see it. I'd love to see. They let me see his knee surgery.
You can see the pictures afterwards.
Okay.
Oh, okay. After the angioplasty, they may be able to use a balloon to open up those arteries. And possibly use a stent. Did you ever play?
What's a stent?
Did you ever play with bamboo handcuffs when you were a kid? Finger handcuffs? Those toys?
And it's hard. You get your finger in there, more you pull.
Exactly.
Yes, yes, yes. I did play with those. That's what it would be like?
It's just like that, but it's made of metal. They put that in the heart artery and blow up a balloon, blow it up with a balloon, and it holds the artery open and helps it to heal.
Once that's added in there, it's left.
It stays there.
So what you're saying is that you go in with the angioplasty look, and then you can go in and put in the stent, and that stays, and the artery will stay open.
Hopefully. In most instances, it will stay open.
So what causes it to not stay open? To, you know, why would it be?
Some people have scarring in the stents, and that can be treated with another balloon.
But originally, why would you go in? Why would you need to put the stent?
Because the artery is partially closed from cholesterol buildup, the cholesterol problem.
Okay, got it.
We're also going to be sending you for a blood test to check your cholesterol levels again.
I hate that.
Okay. And you may benefit from medicines for cholesterol. Okay? So we have a lot of information. We have prescriptions for 2 new drugs, the atenolol, which you take every morning, the nitroglycerin that you use under your tongue only if you have pain that doesn't go away in 5 minutes.
Is that covered by insurance?
What type of insurance do you have?
Medica.
That would be fine. I'm sure they're covered.
Okay.
You will probably have to pay a copay, whatever your standard copay would be.
Yeah, yeah.
Okay, and the aspirin I'm going to ask you to buy as well. Okay. You'll have the...
Boy, the list is getting long.
No, I'm writing it out for you.
It's better to stay healthy than to, be exhausted and can't breathe. That's right. She's right.
Okay, the blood test for cholesterol. And the nurses will help schedule that stress test for you.
Okay.
We'll try.
And just go to the front desk to get it scheduled.
Exactly. We'll try to do that in the next week. and we'll make an appointment to see me after that stress test. Okay. It's a lot of information. I have it written down here. And the office number is here. If you have questions, please call, and the nurses will help answer any questions. And I'm available at that number as well if you need to talk to me. Okay? Do you have any questions or concerns?
No. Take your medicine, get the stress tests, go to the lab, and then we'll come back in for results. Okay. You ask, oh, I do have a question. Should I stay, continue at work just doing my regular job, or try to find light duty work?
Are you able to do light duty?
You know, if I get everything filled out and you sign something, work would make those adjustments for me.
Okay. Would a 30-pound weight load be possible?
Yeah.
Would
Plus, I would think, put down no extra overtime.
Okay. Great. We'll fill that out.
I'll be okay, Anna. I'll be fine.
Okay. Remember, if you have pain that doesn't go away with nitroglycerin, between now and the visit, you'll dial 911.
Okay. Take it, the nitroglycerin. If it doesn't, say your question again. If I take it, and then the pill dissolves, right? That's what's going to happen? Okay. And make sure that you understand. So if you still have the pain for 5 minutes and it doesn't go away, it's still bothering you, you take the nitro, then you wait, and if it's gone, then you don't take the second pill. But if you're still having pain, it's getting worse, take the second one. You can go up to taking 3, and then you have to call 911. My wife's...
Perfect. Perfect.
Okay.
Anything else we can help you with?
I think when I get home, of course, something will come up, but I can call. Great.
Okay. Good to meet both of you.
Yes, nice to meet you. Thank you.